I'm Naomi Travers. I am founder of Alembra Medical. I am a geriatric nurse practitioner and I've been in the nursing field for over 15 years. And I am on a mission to improve the way we diagnose and treat urinary tract infections in frail elderly women. I think the current standard of care is inefficient on so many levels and underserves one of our most vulnerable patient populations. In my experience, the root cause of the problem is that this population has multiple physical and cognitive impairments that make it difficult or impossible for them to provide a clean urine sample for diagnosis of a UTI. Incontinence, dementia, and limited mobility are among the many barriers. UTIs represent an enormous burden to our healthcare system. They are the most common bacterial infection among women, and the incidence increases significantly as women age due to a number of physiological changes. Medicare alone spends over $3 billion treating UTIs in women over 65, and that represents only a portion of the financial resources spent on this extremely common illness. Currently, there are really only two bad options for collecting a urine sample in the frail elderly population: either messy, unreliable bedpans or invasive, degrading catheters. Even the most well-intentioned caregiver will find it challenging to get a clean sample while a patient is on a bedpan. The ergonomics and gravity just make it very awkward. Samples are contaminated in approximately 21% of women compared to only 9% of men, according to one recent study. That wastes tens of millions of dollars just in lab resources. More importantly, contaminated results provide no conclusive data. As a clinician, it is extremely frustrating having to choose between the lesser of two evils: either repeat the test and delay treatment, or treat with antibiotics without really knowing if the patient actually needs them. Antibiotic resistance is an enormous threat to healthcare institutions around the world, and now more than ever, diagnostic precision is paramount for quality care. Catheterization is more reliable but can be very traumatic to a patient who is ill and confused. As a nurse, I hate having to restrain a frightened patient and subject her to this invasive procedure. I wouldn't want it done to me or my mother or any other loved one. I've been working on a solution and have developed Spessel, a specimen collecting vessel that conforms to the female anatomy and collects a midstream urine sample easily and efficiently. Spessel is a disposable device that sits comfortably next to the perineum. So this is our first prototype. It's very simple. Basically, this protrusion is meant to sit in the vaginal opening and acts as an anatomical marker. With that in place, we know that the opening of the vessel surrounds the urethra. Then when the patient urinates, the first pass of contaminated urine goes into this section and stays there, and then the remaining clean sample flows into this tube and into this receptacle here. The tube allows the caregiver to access this container outside of a diaper with which incontinent patients may be wearing. The patient doesn't need to follow any instruction or participate in any way, and she can remain in bed if needed, but able-bodied women can use it as well. Most importantly, since the device sits outside the urethra, placement is not a sterile procedure. That means that it can be used by non-licensed caregivers in any number of outpatient settings. For that reason, I think this will be an absolute game changer in aged care and women's health, by giving caregivers the tool they need to perform this common task easily and efficiently. I think of it like this: imagine trying to build a house by using a rock to drive in the nails. It can be done, but it would take a lot more time and be awkward to use. Of course, you would rather have a hammer. Spessel is the hammer that caregivers need and deserve to perform the urine collection task. I hope that by providing this tool, we can radically improve nursing practice, provide more timely and targeted care to patients, and save millions of healthcare dollars on multiple levels. There is a lot of development work that still needs to be done, but our prototype has been successfully bench tested using dyed water. We imagine that the ultimate product will be made out of silicone, and there would be a soft, malleable material around the opening so it can conform to each individual patient. The simple design should be extremely cost-effective to manufacture. If you've ever had a UTI, provide care for patients with UTIs. have a female loved one in aged care, or if you just want to see better patient outcomes and more efficient healthcare delivery for seniors, we would really appreciate any support that you can give. Thank you.